We're just refreshing the slides and then we'll start. Oh, that looks like a thumbs up. Is that a thumbs up? Say great. Hi, I'm Tony Avery. I'm an academic GP from Nottingham, and I'm a National Clinical Director for prescribing for NHS England. Absolutely delighted to be chairing this session and starting off with a short presentation. Massive interest of mine. I'm just really excited with the work that's going on around the country, around the world, but particularly in the country, and particularly in terms of your collaboration. I think we really have got some opportunity to improve things. I know things are challenging to get going, but I really see incredible potential here. So what I'm going to do, I've been asked to just give a national perspective. That's particularly an England national perspective, but you know, I think what we say in relation to England is pretty relevant in terms of other countries, and I work very much with the other countries in the UK. And then we'll introduce our speakers and then have some opportunity for discussion. So can I have the next slide, please? Or shall I? Sorry, I'll see if this works. Yes, it does. Sorry. So I'm talking about addressing overprescribing. I'm in my role because the role of National Clinical Director for prescribing for NHS England came about because of something called the National Overprescribing Review, which was published in 2021, which identified some of the challenges associated with overprescriptions of medicines. And there are 20 different recommendations that came from the review, which I'll just touch upon in a moment. But you'll be very familiar with this slide showing the scale of overprescribing, showing that over a 20-year period in England, at least, then the number of medicines prescribed in the community for patients has doubled to over 20 medicines per patient per year. On average. And of course, as you know, polypharmacy increases with age. And again, in England, but this is relevant to the other nations, the chief medical officers, in fact, all chief medical officers report on aging in Health in an Aging Society came out last year, highlighting the importance of looking at, as people get older, not necessarily more medicine, but actually sometimes less medicine may actually be better for people. And it's having realistic discussions about whether more treatment will actually improve people's quality of life, particularly people with complex needs. So in terms of the size and scale of polypharmacy, so in England in 2023, there were nearly 1 million people who received 10 or more medicines. Just over 400,000 of those were aged 75 and over, just over 135,000 aged 85 or over. So that's roughly 7.5% of the population aged over 75, 8.5% of the population aged 85 and over. People, if you're on 10 or more medicines, you're 3 times more likely to suffer harm. And there have been many estimates of the risks of hospital admission associated with medicines, but one from colleagues in Liverpool came out with a figure of 16.55%. So just in terms of the National Overprescribing Review, which is what I'm working on, then this came up with 20 different recommendations. I'm not going to go through all of these today, but quite a number of them are relevant to the work that you are doing. So we've got work we're pushing forward on improving repeat prescribing processes, which I'm sure could be improved with AI, on regular reviews for making sure that when clinicians are doing a review of a patient, then we have all the necessary information for that. The importance of awareness and behavioural change, both for clinicians and for patients. The importance of human factors, so taking that into account when we're designing software, for example, for computerized alerts. Of course, research and evaluation was one of the important recommendations, and there have been some great work being done, and indeed you as a community are doing some great work here. and then all the work on workforce education and training, and finally data analytics. So that's just me coming to the end of my little bit. And so I'd like to go on to Lauren now. So Lauren is a reader in clinical pharmacology and therapeutics at the University of Liverpool. She's an honorary consultant in general internal medicine and the COPE